As a clinical exercise physiologist and registered dietitian, I am naturally a huge advocate of cardiac rehabilitation programs whose mission is to restore and maintain and individualize optimal physiological, psychological, social, and vocational status. I'm Shayna Hicks, manager of St. Luke's Outpatient Cardiopulmonary Rehab Services, and I'd like to take the next few minutes to share with you the what, why, how, when, and who to refer to cardiac rehab. St. Luke's Cardiac Rehab is a medically supervised outpatient program. A supervising physician must be on site and immediately available if needed, who also signs off on all our individualized treatment plans on a regular basis. The primary goal of our St. Luke's outpatient program is lifestyle modifications to improve individual outcomes and secondary prevention through risk factor management and monitored exercise progression. After we receive a referral for cardiac rehab services, the patient is set up for an initial evaluation with one of our trained clinical team members who will develop an individualized treatment plan and assign the patient to a specific class with other cardiac patients. Most cardiac rehab programs are equipped to monitor ECG on each patient while exercising and require all patient care staff to be basic life support certified. Our program has a code cart readily available, as well as at least one team member who is ACLS certified in each evaluation and group class. We also have several caregivers who are trained to work with individuals who have ventricular assist devices. Each group class meets 2 to 3 times a week for up to 36 sessions. The number of sessions are based on the patient's clinical status, risk stratification, risk factor status, the patient's progression and goals, as well as how many sessions their insurance plan will allow. As a certified program through the American Association of Cardiovascular and Pulmonary Rehabilitation, we uphold high standards for safety and quality of care for those we serve. Our program goals, along with reducing the risk of future cardiac events by stabilizing, slowing, or even reversing the progression of cardiovascular disease, are to identify, modify, and manage risk factors, improve functional capacity, alleviate activity-related symptoms, educate patients on how to manage their heart disease, and improve their understanding of their diagnosis, as well as improve their quality of life. The core components of the program are baseline and ongoing patient assessments, individualized risk factor management, and exercise training. A referral to cardiac rehab outpatient program upon discharge is a Class 1 indication, or strong recommendation in clinical guidelines for heart surgery, myocardial infarction, coronary intervention, chronic stable angina, chronic systolic heart failure, and peripheral artery disease. Strong evidence demonstrates that participation in early outpatient cardiac rehab results in a reduction in all-cause mortality ranging from 12 to 24%, reduced cardiac mortality from 26 to 31%, reduced readmission rates to hospitals. There's also a strong dose-response relationship between the number of cardiac rehab sessions and long-term outcomes. There's improved adherence with preventative medications, improved function and exercise capacity, improved mood and quality of life, increased self-esteem and confidence, as well as improved modifiable risk factors, including psychosocial benefits. Medicare will cover 80% of the allowable charge. Supplemental insurance policies usually pay the difference, but the patient is responsible for payment if he or she has no supplemental policy. Studies adjusted for quality of life show savings of $4,950 to $9,200 per year of lives saved, and reduction in rehospitalizations and medical costs are well documented. Other private insurance companies may cover cardiomyopathy, atrial fibrillation, or a new pacemaker. Despite the clear and tangible benefits, cardiac rehab programs remain underutilized. A 2016 report estimated that only 19 to 34% of patients subsequently participate in cardiac rehab, and a 2015 study reported that just over 20% of eligible Medicare patients with acute myocardial infarction used cardiac rehab services. There are a number of barriers that contribute to low participation rates, including, but not limited to, lack of referral to participate from the patient's physician and lack of perceived need for rehabilitation or awareness of what cardiac rehab is all about. The Million Hearts Initiative to Prevent 1 Million Cardiovascular Disease Events by 2022 developed a roadmap to increase participation in cardiac rehab. The roadmap outlines key action steps and best practices to increase cardiac rehab participation rates from 20 to 70%, with strategies to improve referrals, enrollment, and adherence. So, how does a physician benefit from referring their patients to cardiac rehab? At St. Luke's, we thrive on a multidisciplinary team approach to patient-centered care. All our caregivers directly involved in cardiac rehab are trained to educate, evaluate, and triage patients in collaboration with the referring physician and their teams. This partnership in management provides enhanced access to physician services, reliable surveillance for improved clinical outcomes, improved patient satisfaction, patient education for self-directed care, enhanced medication compliance, safe exercise behaviors, and long-term health benefits. Cardiac patients have many disease processes and lifestyle concerns that have contributed to their heart disease. Cardiac rehab serves the needs of each patient while working towards secondary prevention. Cardiac rehab truly adds value to your patient's care and increases their quality of life. Every positive improvement is a step in the right direction. Thank you for taking the time to view this presentation. If you have any questions, please don't hesitate to reach out to Dr. Greg Carter, St. Luke's Cardiac Program Medical Director, Heidi Moser, Cardiac Program Director, or myself, Program Manager. We look forward to partnering with you to care for those in need.